What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.
And welcome back. Well, today from Hoag Medical Group, we have on Dr. John Cow. Nice to meet you.
Nice to meet you.
You are internal medicine, and how long have you been with the Hoag Medical Group?
I actually just started a couple months ago because Hoag Medical Group is a new group. And I think the whole idea was that, well, initially, I just finished training at Loma Linda University.
Okay.
And I actually grew up in Irvine, so I'm kind of
You're right there.
Looking for a job. I actually wanted to come back and kind of help the community. And well, Hoag Medical Group starting up, and kind of their philosophy was, they want to give patients time. They wanted to make sure, when you come in, it's not just the 5-10 minutes and then boom, you're gone. You get your prescriptions and you left. And also, it helps, I guess, my patients get into the great facilities at Hoag, the Hoag Newport Beach hospitals, or the new hospital in Irvine as well.
Yeah, so it's very convenient for folks. That new hospital is very close by. And you work in one of the offices, one of the clinic offices. You were telling me it's right there. It's right next to the hospital.
Yep. It's actually, everything's connected. You don't even need to walk outside.
Yeah. And Hoag Medical Group, it's rather new, but it's actually now part of a larger group as well, isn't it?
I think we are joining with other groups like St. Joseph's and everywhere like that to try to, I guess, help everyone in Orange County. I think that's the aim right now, and then we'll see where that goes.
Yeah, so it's much broader than people might think just beyond Hoag. But Hoag is a name that certainly in Southern California has been one of the premier hospitals around down there in Newport Beach. And as they've expanded, they've been able to help a lot more people. And having one very, very close by is nice for the people who live in this community. So you want to talk about, you are in internal medicine, but you really wanted to talk about today the topic of cholesterol, and not a real glamorous topic, the topic of the trend topic. You know how you go in those sort of waves, or there's the topic of the day, so to speak, that you hear about over the course of time, and people don't talk about it as much. And I think that's been the way with cholesterol. There's been other things that people have talked more about, but cholesterol has always been an ongoing problem. And there's really, when people hear about their cholesterol levels, tell us a little bit exactly what that means, how there's two types of cholesterol. There's cholesterol, obviously, that your body manufactures, but then comes in other forms as well.
Well, I think it's like anything in the body. Everything we kind of have at a moderate level than our body needs. And then when things start getting too high or out of whack, then we start having issues. And you're right, cholesterol has kind of been not the most popular topic. I think partly because when we first discovered things going on in it back in in the 50s and 60s, that's kind of been steady, always there. And then new things come up like heart attack, like diabetes and things like that. But I mean, to me, everything's kind of related. So it's important to understand then that with cholesterol, the idea is in the blood vessels, when you have damage to the blood vessels, either through having high blood pressure, having diabetes, which puts you more prone, then having high levels of cholesterol will kind of start basically, making plaques in your arteries. So you can think of it as kind of the cholesterol getting into the walls of the arteries, and then you slowly it narrows. And then that's when we start having problems. So, if you get your blood vessels go into your legs, and those are narrowed. When you're walking, suddenly your legs can't get enough blood, and you start feeling fatigued, and some people start even feeling pain. If it's going to the arteries going to your groin, then men with this will have erectile dysfunction.
So it's, like you said, it's all related.
Yep.
And when it comes to cholesterol, there are folks who are naturally have high cholesterol. They may have a very good lean diet, but there are people who are maybe it's just they're born this way or it's hereditary. And of course, the other folks that the high cholesterol comes in the form of their diet.
Well, we know that for people with kind of we call it familial problems with cholesterol, they have a higher incidence of these problems like heart disease, like strokes, and things like that. So we try to control that with medications. For the other folks, what we will always try to do is try to lower that, lower the cholesterol in the diet. And we found that kind of one of the greatest risk factors is this Western diet, this high-fat, low-vegetable diet, and also with a lifestyle of low exercise and kind of just sitting around and things like that. So you'll probably hear your doctor always saying, you want to watch your diet and also exercise, because actually exercise will lower your cholesterol.
Right, and I think one of the confusing things that we hear is, I don't know, every week there is some study that shows here's something that if you have on a daily basis or a few times a week, really helps out lower your cholesterol and heart disease and all that. A few weeks ago, I heard one about, you hear about wine quite often, red wine, and if you have this much, that's fine, but don't have that much. And it goes on and on and on, olive oil and things like that, and the oil you get out of certain fruits and vegetables, flaxseed and avocados and things like that. But it can be overwhelming when your high cholesterol might be diet related, what to cut out, and more importantly, what are the proper things that you should eat more of?
It's actually a little bit confusing for us doctors too, because new products are always coming out, and we're not quite sure what to make of it. And then there's always new studies here and there where they have maybe 50 people, 100 people, they took it, and then they just measure the cholesterol and see what happens. So a general good rule of thumb, when you walk down the grocery aisle and you'll see all these different banners here and there saying this low fat is, they have food labels in the back. Just remember, kind of try to avoid the trans fats, try to avoid the saturated fats.
Right.
So always try to go for the unsaturated. And they usually say poly, which means many. So polyunsaturated is even better than mono unsaturated.
Okay, all right. Within cholesterol, there are two measurements, HDL and LDL. Explain the difference between the two.
There's actually a lot of different kind of cholesterol or fats in our body. And when we usually measure, you hear about the HDL, the high density lipoproteins, and which we say are the good cholesterol. And that kind of will help reverse the plaquing that we were talking about a little bit before. Whereas the LDL, or low density, that will actually help make the plaques. And then we have other things like triglycerides and total cholesterol that you talk about. Just kind of through our experience and through all different studies we've seen, our current thought is that we want to try to control the bad cholesterol first, the LDL, and then slowly work on the triglycerides and the HDL. And then as we're doing more and more study, a lot of them on people who are at very high risk, with the heart disease or at high risk for stroke, then we're starting to see, maybe those people we have more benefit of trying to get control the good cholesterol, get that high up, and get the triglycerides down. But the push right now is always to get the bad cholesterol down first.
What does the good cholesterol? What makes it good? Why does our body need the HDL?
All we know right now is that it seems like it reverses the plaquing. So the way I think about it, I don't know if it's exactly how it plays out, in your body, but as you get kind of these damage in your blood vessels, again, through blood pressure, through high blood sugars, if you have uncontrolled diabetes, you get these like micro little nicks in your blood vessel walls, and then the really small particles, the low density or LDL, they can get in there and settle in there. And then because it's in there, your body says, it's not supposed to be in there. So it starts attacking, you get this inflammation, and eventually you get hardening there. And there's those little plaques that one thing we're about is kind of narrowing the blood vessels. So we have narrowing the blood supply. Another thing is sometimes they'll burst. And then when they burst, is all these little particles come out and they'll kind of flow down to small blood vessels. And that's when we're worried about things like heart attacks, strokes, and when people get these sudden events.
So it can really be, as you said, everything kind of connects together, but you start at the root of the problem being the high bad cholesterol that you need to take care of. What, when you do the cholesterol measurements, and this is another thing that has gone back and forth for years. It used to be that magic number of being below 200. Then I've seen over the years that has changed sometimes because it depends on the person. Someone may have it at 250, but if everything else is going pretty well for them and they're healthy, that number might mean not quite as much. Again, it can be confusing.
So I know everyone likes to have these magic numbers, and the whole idea is as you have more risk factors, as you get older, if we know you have heart disease, then we want to get all your cholesterol numbers lower, the bad cholesterol numbers lower. So then we'll start saying, well, for your bad cholesterol, instead of being 160, we should want you to get below 130, below 100. And nowadays, people are saying even get it below 70. So you can see the trend is to kind of get those even lower and lower and lower. And I think eventually, after we get that, then then we'll start focusing on getting your good cholesterol numbers higher and higher and higher and things like that too.
When you get your cholesterol number, let's just say hypothetically it's 170, 180. Are both the bad and the good cholesterol factored into there, or is that where you might say, well, your good cholesterol is 170, your bad cholesterol is 180? Do you give two? Is that how you?
Typically, we'll get two numbers from the lab.
Okay.
And then we can start kind of, I guess we would say, jiggering around with the numbers. There are some people will look at the different ratios and things like that. We think that's more predictive. Or other people, they'll just say, let's just focus on the specific numbers of how much good cholesterol, how much bad cholesterol you have, and go from there.
Okay. All right. Very good. And this is something that, I guess, depending on your age and your health and your family history, you need to check on a fairly regular basis, wouldn't you say?
We typically recommend, even now, people as young as in their 20s, to at least get it checked once, just to make sure everything's doing okay. And then as you get older, we can check it more frequently, either every 6 months or again, depending on risk factors, every 3 months. And the idea being, if you check it initially and get you on the interventions that you need, as we get it under control, then you can check it less and less and less.
All right, very good advice. And if you're interested in getting hold of Dr. Cao, call the Hoag Medical Group number at 949-791-3101. Their website is hoagmedicalgroup.com. It's a pleasure to have you on, and you're right nearby.
Nice
and welcome to Hoag Medical Group.
Oh,
you haven't been
thank you.
with them that long, and they're a great organization to be with.
Thanks.
We'll see you again. We'll be back in just a moment.